it's Dr. Stephanie Waggle here, and today I'm going to talk about patient termination and non-negotiables. So usually when I have a patient, I obviously make a diagnosis, come up with a treatment plan, and it makes sense for people to follow my treatment plan, but of course, occasionally there's disagreements or compromises to be made. For example, if somebody is having poor sleep and they're co-sleeping with a 2-year-old, and I say, well, if you want your sleep to improve, you have to maybe transition the 2-year-old to their own bed, that sort of thing. We talk back and forth about how that might be easier, how that can be achieved, or if they say, you know, that's really not something that I'm going to be able to do right now, that sort of thing. We talk back and forth about it. So that's just an example. I work with people. I make suggestions. If they state that they can't follow through, we'll work together. But there are sometimes non-negotiables, and those will be things that I recommend that if patients do or do not do, depending on what my recommendation is, that I cannot continue being their doctor. So, of course, most things are on a case-by-case basis. However, there are some examples of things that I have had to part ways with patients over. For example, for the controlled substance contract, it states that it is not safe or appropriate for patients to get controlled substances from multiple doctors. It's called doctor shopping, but basically it's for your safety, because a lot of controlled substances can interact together poorly and ultimately cause death in some instances, and I would want to prevent anyone's death. But there are cases where I will look people up and find that they have been getting 60, 90 tablets of Adderall from 8 different doctors, and that's just not appropriate, and I will terminate a patient for that. That doesn't mean that I hate them. It's nothing that they should take personally or be personally insulted. I warn people several times that this is just not an acceptable behavior and that it will result in termination. If you get a letter of termination, don't take it offensively. I have a list of all my current patients, and I have to update that list in order to make room for new patients. And if I have a patient that just is not attending their appointments, I may have to terminate them and send them a letter of termination because I need to make room for new patients on my patient panel list. So there are different reasons that I would send a termination letter, but it happens, and it's not anything that is meant to be offensive. It is because I can only see X number of patients. It doesn't make sense for a person to continue seeing me if they're not coming to their appointments and not following my recommendations. And so keeping them on as a patient just doesn't make sense. And just to be, because here at Improve Life, in case you haven't picked up on it, we love policies and sticking by policies, having boundaries, having clear and consistent rules. And so when I terminate a patient, I go by the book, which means sending a letter via certified mail and first class mail. I don't send that to try to be scary. I just send that because that's what the recommendation is. And don't be offended by the letter. It's just a formal way of notifying you you're no longer on our patient panel. So if a patient hasn't been seen in the office for 6 months or more, then they're technically not still a patient anymore. You do have to follow up periodically. If I haven't talked to you in 6 months, I have no idea you have a new medical diagnosis, or if you're on a new prescription medication, or heck, you could have got married or had a baby in that time frame. Like, I have to stay updated with what you're doing. So in order to continue being on the patient panel, you do have to check in. And if you do something or something happens where you're removed from the patient panel, you'll receive a formal letter. And again, it's not to be mean, it's not to be scary, it's just a formality so that we can keep track of our current patients.